This week on Healthy Living, 1 in every 23 people now needs humanitarian assistance. An expert shares the challenges of global humanitarian assistance. Plus, scientists warn heart disease is linked to even lower blood sugar levels. And how one dog trainer is shaping puppies into life-changing service dogs to help the blind. These stories and more in this edition of Healthy Living. Hello, I'm Kamiti Kibayasi. Thank you for joining us on Healthy Living. According to the United Nations, 1 in every 23 people now needs humanitarian assistance. In 2023, a record 339 million people need humanitarian assistance and protection, a significant increase from 274 million people at the beginning of 2022. UN and partner organizations aim to assist 230 million people, most in need across 69 countries. There is a growing number of complex, long-term crises, and the pressure placed on the humanitarian system to respond is only set to increase in 2023. This trend is being driven by continued system-wide shocks, including climate change, in the wake of the military coup in Niger and the sanctions imposed on the country. The activities of some NGOs have slowed down. This has caused frustration to the communities they help. Our correspondent in Niamey, Abdulrazak Idrissa, met the heads of two organizations working in the fields of gender, peace and security and health. Here's more.
Hamza Jibo is the executive director of ESCAVI, which stands for Education, Health and Improvement of the Environment. His organization provides access to health services with a particular focus on malaria sufferers. It also promotes universal health coverage in Niger. Since the coup d'etat, the partners who fund its activities have either suspended or postponed their aid. To adapt to the situation and limit the negative effects of this suspension, many have prioritized their interventions.
ECOWAS has imposed a wide range of sanctions which have negatively impacted the health sector, which in turn have crippled the implementation of our activities in the field, since many of our partners have suspended their disbursements and fundings, while others have reduced or limited their funding.
To adapt to the situation and limit the negative effects of this suspension, many have prioritized their interventions.
If I take the case of malaria and the question of CPS, a seasonal prevention campaign, the fact that we bring medicines for the prevention of malaria to children aged 0 to 5, as we know that we are in the peak period of malaria in Niger. So we are trying to ensure that these activities can continue at community level.
Rabia Jibo Magagi coordinates the Alliance for Peace and Security, an organization working in the fields of gender, peace, security, human rights and governance. Before the coup d'etat, she was supposed to travel to the Tillaberi region for her work.
We can't go because we can't access money from the banks. So we're waiting to see because we don't even know which authority to turn to. We have new governors who aren't quite settled in, even though we're working with them. There's the Regional Directorate for the Protection of Women and Children, but now there's no ministry. We don't know who we're going to talk to when we go to Tillaberi. That's where the difficulty lies.
As the situation escalated between Niger's new authorities and the international community, particularly ECOWAS, several international NGOs warned in a joint statement that increased instability and sanctions could exacerbate the humanitarian needs of the most vulnerable, especially women and children. For Abdulrazak Idrissa in Niamey, I'm Vincent Makori, VOA News.
Dr. Gwamaka Edward from the National Health Insurance Fund, NHIF, in Dodoma, Tanzania, tells us more about challenges facing health workers engaged in humanitarian assistance.
There is a challenge of logistics, how to transport medical commodities to the places in need. So the issue of logistics is also a challenge, the supply of health commodities to the place in need. Also, another challenge is the moral issue. During the war, there are two sides opposing each other. So the issue of neutrality and impartiality in providing care is a moral dilemma to healthcare workers. For instance, in areas where there are labels, so someone may just judge those people that deserve punishment because they are opposing the government, but according to medical ethics, you have to attend all of them, all casualties of both sides. You have to attend equally. Another challenge is lack of equipment. In a low resource setting like Africa, our healthcare system is under budgeted. So availability of medical supplies for emergency, like you need maybe ambulance, you need the ground ambulance, drugs, equipment, but when the country does not allocate enough resources for healthcare system, it is a challenge. Another challenge is the issue of expertise on how to handle emergency cases. So in a low resource setting, you find that we have few experts who have been intensively trained to give emergency services to people in need, because this is a specialty, emergency medicine. So we need a qualified people who have been trained, specifically specialized in providing emergency care. So that is the issue of knowledge and the coordination during crises like floods. If there is floods or there is earthquake, you need people who are good in basic life support and advanced life support, who can adequately provide care to the wounded, to the casualties, to the people affected. And we understand that during floods or during earthquakes or war, children are the most affected, and the women. So you need appropriate expertise to provide care to those affected population.
Researchers who have carried out the latest study on the links between heart disease and diabetes say it's not a surprise the two are linked, but they hadn't expected that so many people with just a slightly higher blood sugar would also be at a higher risk. Public health researchers from the London School of Hygiene and Tropical Medicine examined the records of 420,000 people enrolled on the UK Biobank, which stores biomedical data like scans and the results of blood tests. Here's more in this AP report narrated by Karina Chaudhry.
The scientists picked out people enrolled between 2006 and 2010 and, importantly, included people who didn't have a history of heart disease. They then tracked the outcomes for that group over 15 years. Professor and study author at the London School of Hygiene and Tropical Medicine, Dr. Christopher Wrench, explains the results.
What we found is that the risk of heart disease was present both among those who had very high blood sugar levels, typically the amounts used to define diabetes, but also we found these risks present in men and women with moderately elevated blood sugar levels below the typical threshold of diabetes.
The study also indicated the different risk levels for both men and women.
Men were between 30 and 50% at higher risk of heart disease. That's ranging from 30% at moderately elevated, the pre-diabetes level, all the way right up to diabetes level. Those same figures in women range from 50% to 100%, going from pre-diabetes levels of blood sugar all the way up to diabetes levels.
And evidently, there are factors that explain the relationship between blood sugar and heart disease for men and for women.
We found there were 4 factors that explained the largest variation between men and women in the relationship between blood sugar and heart disease. Those 4 were 2 of them measures of obesity, body mass index, and our waist-hip ratio. The other 2 were the use of preventative medications like antihypertensive and statin medications. Women at every level of blood sugar level were more obese and had a more adverse waist-hip ratio than men in our sample. They, at the same time, had lower usage of preventative medications like statins and antihypertensive at every level of blood sugar.
Dr. Wrench believes the next stage is to examine how blood sugar levels affect heart disease.
Deborah Wydra is a dedicated service dog trainer who has been doing it since her high school days. VOA caught up with her recently while she was working with Guiding Eyes for the Blind to prepare their puppy Ike for his formal training. VOA's Faiza El Masri brings us the story from Oakton, Virginia.
I'm Deb Wydra, and I teach English at Chantilly High School, and I'm also a puppy raiser for Guiding Eyes for the Blind. Our job as raisers is to start with them at about three months old, somewhere in that area, and gradually increase the time and duration that we expose that puppy to really intense experiences in society. So that's why coming into a school, which is what I do with my puppies, can be really intense. That's a lot of dynamic, it's a lot of people in a small space that create a great list of experiences for a guide dog that will need to go out someday and not be rattled by an emergency vehicle going by, or someone touching them, or someone stepping on them. The students really love when I bring Ike in. Ike does bring an element of calm to the room, sometimes a little bit of fun. He's next to me, he's very quiet. All the dogs I raise, they're usually very quiet. They can lie down for the whole school day, which is what they'll probably do. When I was in school in California, one of my classmates' mother was blind. And that got me interested in the world of service dogs. And the service dog I introduced to her, and she didn't realize that service dogs are free. And right after that, she got her first guide dog. And I realized what an amazing feat of independence having one of these dogs is. So today we are driving the van up to Guiding Eyes. My husband is cleared to drive the van, so we're driving a big van up I-95 that says Guiding Eyes for the Blind on the side. What we'll be doing is dropping Ike and another puppy off at the training center.
You ready to get busy one more time here?
Today's his last day, so we'll be saying goodbye to him when we drop him off at Guiding Eyes.
That's a good boy. You ready to load up?
It is a very, very emotional experience. And you know that this animal you've spent so much time with is going to do something really great for another person.
All right, Lisa.
So yeah, sorry about that. Get emotional.
Thanks for watching Healthy Living. For more latest news and coverage, stay connected to Voice of America at voanews.com. You can follow me on Twitter at MkamitiVOA. That's our show for today. Until next time, stay well and strive to make every day a healthy day.